Hi, this is Kathy. This is my first video ever, but also my first video since I had L4, L5 lumbar fusion on February 6th, which was about 20 days ago. The reason I'm doing this is because it was so helpful to me to see all the other videos from folks who had been through the experience, and I wanted to try to do something similar that might help others in the future. So it's 21 days post-op, a large incision, PLIF, which is posterior lumbar interbody fusion. There's hardware in there, screws and rods between L4 and L5, a cage with a bone morphogenic protein, as well as a graft from the left iliac crest. The first week, I'm going to tell you, it's a blur. It's the medicine and the pain and just the recovering from a long surgery under general anesthesia. And it's just a blur. I actually was only in the hospital for 1 day. Wanted to stay longer, but was up and walking about the day after surgery with a walker. I did have sometime during the first week or so after the surgery a good bit of swelling near the near the site of the surgery, which caused me to have radicular pain as well as bladder control issues. My insurance company actually called my physician about this, and he phoned me and asked me to go to the emergency room. In the emergency room, everything looked fine on the CT scan, and so they just sent me out on steroids to reduce the swelling, and that actually did help. It helped with the symptoms a great deal. I used a lot of pain medicine the first week, but then was encouraged to find alternatives. So, which was a good idea. I mean, despite the fact that it's pretty painful, it's really better to sort of, I think, listen to your body and know a little bit about what's going on. So I have since then, since that first maybe 10 days, tried to decrease the pain medicines significantly. And, you know, I'm not going to lie to you, it's uncomfortable. You might have trouble sleeping at night, like particularly, you know, the first 2 weeks, waking up in the middle of the night can be very, very, very hard to go back to sleep just because of the pain, and it's so difficult to move around. At this point, I'm still resting most of the day on the sofa in a sort of semi-reclined position. Try to get up and do as many things for myself around the house as I can, although there are some restrictions on bending, lifting, and twisting, which sort of give you a creative challenge on how to do some of those household things. Anyway, I'm gonna sort of skip over to some bullet points. I actually wrote these down so that I wouldn't forget. Things that I've realized. Number one, you won't be able to tie your shoes for 3 months, so buy some clogs. I like Dansko clogs. I mean, they're easy to slip on and slip off. You just stick your foot in there. There are also some really great garden clogs that are comfortable and that you can wear around. So clogs and flip-flops are a must. You will not be able to tie your shoes for the first 3 months. Number two, you're going to be squatting a lot. So if you haven't had the surgery yet, it might not be a bad idea to work on your quads a bit and increase your quad strength, because anytime you need to bend, you will be squatting down instead. Number three, shoulder rolls feel great if you're just looking for things to comfort yourself, because you're going to need some comforting for sure. Shoulder rolls and glute sets both feel really good. Next item on the list here, healing takes time, and let yourself adjust to that idea. If you have been active in the past, before the surgery or before whatever condition it was that led up to the surgery, it's going to be tough to accept the fact that Mother Nature and Father Time have to do their jobs, and you really just have to be patient with the healing process and realize that it's a process, and you're going to be off work for a while, and you're going to be dependent on others to do a lot of things for you for a while, because you can't lift even over 5 pounds, and you won't want to. So even taking out the garbage or picking up your cat or small pet can be something that you might not be able to do. Positioning is really important. I wish I had realized this a lot earlier, so hopefully this will help someone. It can be really uncomfortable laying on that incision when you're in bed at night, or you're just trying to sit around the house during the day. I basically have a stack of pillows that I've sort of wedged up to support my spine when I'm sitting, and I sleep at a partial incline. And since I quit trying to sleep flat, I've had a lot less trouble waking up in the middle of the night with a lot of pain. So you might even invest in a wedge. I don't know. I've ordered one on Amazon, a wedge to sleep on, and I will try to update this post and let you know how that went. If your doctor gave you a brace to wear when you're up and about, it's advisable to wear it, I think. I did go out to a restaurant with my husband about a week ago without the brace on, and just the pain of sitting upright in the chair in the restaurant became excruciating. Don't know how else to put it, and I found that when I wear the brace to sit up for a while, it really does support your back. It really does help a lot. One thing in particular I noticed is that if any of you have an autograft for the surgery from your iliac crest, and maybe you could give some input, but I have found that the graft site does maybe even more sore than the surgical site itself. So in a nutshell, on post-op day 20, after a large incision spinal fusion surgery at L4 and L5, I am just getting to the point where I actually feel well enough to make a video. I hope this helps someone. It's a long process, but you do get a wee tiny bit better every single day. And I will also say the reason that I'm 54 years old, I had been a marathon runner in the past, for the past couple of years, because of spondylolisthesis and spinal stenosis, I hadn't been able to run or even walk very far. So it had gotten to the point where when I even tried to stand up from a chair, I was unable to get my back completely straight due to the spinal stenosis symptoms, the radiculopathies, and the neurogenic claudication. So, coming from having been an active person in the past, you sort of have to adjust your mindset and your expectations. But I feel, I'm taking small walks every day. The pain's getting a little better every day. I'm using fewer and fewer pain medicines. And I will look forward to any comments that any of you may have, and I hope this helps someone.